Hey, Sarah.
Hi.
Just
Yeah.
remind you are recording already. Never mind. That's
Oh,
weird that the link wasn't showing up on your appointment.
I know it
Showed on
just
my.
said Zoom to be sent or something like that on mine, but it sounds like maybe that was just a glitch with mine if others had it
Yeah, it
there.
always worries me because we use Google Calendar, and it just always worries me that people don't use that. It doesn't correct properly. We'll just wait another minute or two to let stragglers join. I did get a lot of declines for this month's learning opportunity. Unfortunately, we may have a small group, which is totally good, but there are a few other people that I'm expecting, so hopefully they can log on. Okay, we're gonna go ahead and get started. Hopefully a few more people join us. I know that this is a really busy time of the year for a lot of us with our annual progress reports for various grants from CDC. So that may explain the lower attendance this month. But as always, we're recording this, so we will be sure to send out the recording afterwards too. So we will start with introductions. And so welcome to the April Place of Peace Regional Network Learning Opportunity. Today our main focus area is on evaluation, and we have a special guest who's going to help us walk through that. I'll let her introduce herself. But just as a reminder, I'm Colleen Capsamalis with the State Health Department here in Colorado in the Violence and Injury Prevention Mental Health Promotion Branch. And I think usually what works best is to read through the attendance list and have people introduce themselves. So I'll call out your name, and then if you could also answer the question on the screen just around your comfort level with planning for or conducting evaluations, that would be great. Felice, you want to go ahead, and then I'll everybody else.
Sure. Hi, my name is Felice Senior, and I'm a violence and injury prevention evaluator with I work in the same branch that Colleen does. And I work closely with her on our core state violence and injury prevention evaluation, as well as a few other projects. And I guess I'll put myself at, if I'm grading myself on a level of 1 through 10, I'll say an 8, because I feel pretty comfortable with evaluation, but I know that there's always more to learn, and there's some new and exciting methodologies coming out, and so I'm excited about always learning as much as I can.
Okay, so Sarah, do you want to introduce yourself?
Sure. So Sarah Brandspiegel, I'm with the Colorado School of Public Health with the Program for Injury Prevention, Education, and Research, also known as PIPER. And we work with Colleen and the folks at CDPHE on several different projects. I would say, yeah, I'm also fairly comfortable with planning and conducting evaluations, although I do always feel like there is a lot to learn, and I feel like everyone is different. There's always unique or unexpected aspects of every project that pop up, which is what makes evaluation interesting and challenging.
Yeah, thanks. And Sarah was out on maternity leave for a few months, and so we're really excited to have her back on Zoom and joining us on these calls.
Colleen?
So next, Jeannie, do you want to introduce yourself?
Yes, I just got on. Sorry, I
just saw your name.
Found the right email, so I figured it out finally. But just introduce myself.
Yeah, and then what your comfort level in with planning for or conducting evaluation.
Oh, Jeannie Beats. I'm with the Nebraska Department of Health and Human Services Injury Prevention Program, and I'm okay with simple surveys. and using those as an evaluation. And we work with our codes for evaluation, but that's about it.
Okay, thanks. And then next, Lisa.
Hi, this is Lisa Roth, and I'm with the University of Iowa's Injury Prevention Research Center. And I would say my comfort level is just right in the middle there, 5. I mean, I think our center faculty have some expertise in this area, but it's certainly something I continue to learn and grow in. And it's interesting, we're just having this discussion because we'll be getting ready to prepare a competitive application to renew our center funding, and we are getting ready to modify our evaluation plan to evaluate the center as a whole. So I'm always excited to learn more. Thanks.
Great, thanks. And then finally, Sally from CDC.
Yeah, hi, this is Sally Thigpen. I am an evaluation officer at CDC. I am pretty comfortable with evaluation, though I know I have lots to learn too. So I guess I'm an 8 as well.
Thanks. Oh, I just noticed. Celeste, I know that you just logged on, but if you don't mind introducing your name and which agency and what your role is there, and then your comfort level with planning for or conducting evaluations, that would be great. Oh, I got a chat. So let's see. Oh, she said she doesn't have audio, so hopefully she can hear us if not able to speak. So welcome, Celeste. Feel free to type in into the chat where you're from. Oh, there we go. So she said she's a code data analyst for Nebraska. Thanks for joining, and we'll definitely monitor the chat, Celeste, so that you can also participate in the discussion later on.
Okay. Great, thank you. So this is interesting because we got a range of responses. We had some people give a quantitative, a number of 1 through 10, and some people provide more of a qualitative, which is definitely due to the way we ask the question. So it's just kind of a fun thing to think about is how we're structuring how we ask questions. Okay, so I think we want to move into, do we have a poll? Right?
Yeah, I just am going to launch it now.
Awesome. So if you could go ahead and just kind of fill in what are the specific barriers you encounter when you're doing evaluations, whether designing or implementing, and if you don't see something that, if you don't see what your barrier is in particular listed, just do the other. And then if you want to go ahead and type into the chat box, because there isn't an option with Zoom on their poll on providing a text response. So if you could just type into your chat box what that actual barrier is, then that gives us a little bit more to work with.
Okay, so the votes are coming in. Okay, I'm gonna fill it out too. Yeah, I can't because I launched it, but okay. I wonder if this. Okay, it looks like everybody voted. So okay. So wait, oh wait, let me share the results. Okay, I can see it.
Okay, all right. So this does not come as a surprise. So not enough time and resources. That's a common one, and I think we all struggle with it. And then difficulties with data collection also. And somewhat related to the time and resources as well, right? But those are coming up as our 2 kind of main barriers. Nobody chose evaluations can seem scary and complex. That must be because we have a lot of evaluators on the line. But that's good. So when we were putting this this quick presentation together, we knew that this was a topic that the group wanted to know more about, was just barriers to evaluation in general, but we didn't know exactly which barriers those were. And so we put together this poll to kind of guide us in our discussion, but in creating the presentation, we kind of just pulled together what are common barriers that we're aware of, that we've run across, and what do we know just exists in the world. And so even though nobody says evaluations can seem scary or complex, we're going to talk about that a little bit. So thank you for filling that out. Okay, so these were the barriers that, again, that we kind of put together, and we thought, we know that these are things that people encounter in the real world when they're going to do evaluation. And I'm not going to read through them just yet, because we're going to go through each one and kind of talk about what that means and talk about some potential solutions or ways to address those barriers. Okay. All right, so yes, I think for some people who are unaccustomed to doing evaluation, even the word evaluation can seem kind of scary. It reminds you, oftentimes evaluation and research, those lines get blurred, and so it can feel like this daunting thing. But I want to just emphasize, if you're in any way tracking what you're doing with your programs or your strategies or your interventions, then you're already doing evaluation. You're doing a process evaluation, essentially. So tracking the who, what, where, when, and how of the activities that you're doing. So a common form of this is, for instance, a fidelity assessment. So this is like getting at, if there's a specific model that you're trying to implement, and you want to know how closely are you adhering to that model. A fidelity assessment is kind of a type of process evaluation. So the next kind of logical extension of process is moving on to an outcome or an impact evaluation. And so this is really capturing the why or the so what of our work. And you're wanting to really use theory, at least, initially, to drive your selection of what are the outcomes that you care about. So if you're, doing an intervention that's aimed at teen pregnancy, you don't want to choose outcomes that are somehow related to, drinking and driving or something, just like totally unrelated to what is the work that you're doing. So there needs to be some sort of frame of the literature and the evidence suggests that if you do this work, it's going to result in these outcomes. And then, of course, that needs to be framed by what is realistic to track. If you're funded to do some work for a year or two, then you're probably not going to be able to continue to follow up with say you have an identified pool of participants, you're not going to follow up with them for 10 years. That's just not, it's not feasible. And remember that you can always scale up. So, if you're currently doing process evaluation, you're doing a good job of, tracking how you're doing your work. You can add in indicators as you feel comfortable and as you have resources and time that allow for it, so that you can build up your evaluation to be a little bit more robust. And also, if at any point you have questions related to these barriers, feel free to either type in the chat or just ask the question, because this can be pretty informal. Okay, so here's one of the big ones: not enough time and/or resources. Yes, I think that evaluation often tends to be a bit of an afterthought when you're going to implement a new program. And so I would really, I think it was Lisa that was talking about this new funding that they're getting for the center, and how you're planning out this kind of more holistic evaluation for the entire center. And so as much of that work as you can do in the front end when you're actually applying for those funds and identifying, what are the indicators and outcomes that you're interested in, and what are some potential ways to collect that information. If you have that work done on the front end, it's going to make it a lot easier once that funding comes through to actually implement it. And then, yeah, so again, thinking about those indicators during the design phase. And then, yeah, many hands make light work. So think about your partners. And I'm going to stress this a lot throughout this presentation, because for me, it's really a big part of why I do the work I do. I really enjoy the collaborative kind of participatory nature that evaluation can take. And so if you're really engaging with your partners, then you have a workforce there that can help you implement these implement the evaluation. It can help with data collection or recruitment or what have you. And then they'll also be involved in other ways, and I'll talk about that a little later. In terms of the costs, I would say, always try to build into your budget, what do you need to do the evaluation. I think the standard of what I've seen is that 10% of your whole budget goes to evaluation. From my experience, that's a little on the low end. I think that provides you with enough to do an evaluation. It's probably a little bare bones, but it'll, it'll ensure that you have resources to do it. But if you can do from 15 to 20%, that's going to lead to a better quality evaluation. And then I think that pays dividends in terms of being able to show impact and then go after funding in the future and say, look, we really know we captured all of these impacts that resulted from the work that we've previously done. And so, and you're showing that you're capable of doing a more robust evaluation as well. And then also don't forget to think about, whether there are opportunities to work with graduate students, who are maybe working on their capstones or thesis projects, who might not have, a ton of experience in the evaluation field, but have that schooling and have the knowledge and just might need a little guidance in terms of, maybe there's a specific data collection project that you can work with them on, building out a survey, and then they can help administer the survey and help, collect the data and then kind of form it, for you, so that then you can help with the interpretation piece. I think there's a few different ways you could do that. Okay, so another barrier we had was stakeholder or partner buy-in. And I think that for me, this kind of comes down to that it's getting to be an old adage at this point, but that nothing for us without us. So thinking about evaluation as a participatory process. So anybody that stands to benefit or is impacted by the work that you're doing, they should be in some way included in that work. And I think that this is useful across the span from implementation or design and implementation all the way to evaluation. And I know that when we're talking about working at the state level, that can be really tricky. It's not feasible for us to go talk with the population of Colorado and get their input on a specific evaluation, but we can find representatives, we can find groups to work with that can help guide that work. So I think one of the best ways to do that, if you can, is to form an advisory group. And so this is really, thinking about those different types of stakeholders or partners that you would engage with that have some kind of level of involvement with the work and the evaluation, and getting, some of those people at the table so that you can continually come together and meet and talk about issues related to not only the work, the program, but also the evaluation, and they can help guide that. Another really helpful piece of that is that those folks that you bring together at the table, they're able to collaboratively define what success looks like. So it's not just, the evaluators who are kind of separate from the work that's happening that are going in and saying, oh yes, here are the outcomes that we're interested in. And really like kind of defining what success is. It's making sure that this is owned by, for lack of a better word, the community or whoever it is, wherever it is that you're doing that work, that everyone has a voice in what that looks like. And then make sure that you're balancing and you're taking, indicators or outcomes that they've voiced that are important, and you're including them into your evaluation along with those other indicators that like here's what the science says. This is what we know is reasonable to expect that we can impact. If they voice that there are other indicators outside of that, I think, in the spirit of being collaborative, it's nice to include those and to balance your evaluation out. And then if they feel like their voice is being heard, they have more stake in that process, and they're more likely to help with the actual rollout of the evaluation. And it just feels good to do it that way. So data collection. Again, I think I basically just made this point, but leveraging buy-in from your partners is really going to help with getting support for your data collection. And I think if they see themselves reflected in whether it's a survey or focus groups or what have you, if they see their voice reflected in the questions that you're asking, then they're going to be more bought in to actually helping collect those data. And then I think that technology, there's a balance there. It can be really helpful. So we like to use SurveyMonkey or web-based surveys to help, and I think it's nice. It cuts down on a little bit of the data entry and also the potential for losing information or losing data. But there are some instances where sometimes technology can be a hindrance. I know in the past we've worked on projects before with youth where we had this great idea of using iPads as the means to have them fill out these surveys, and it sounded like a wonderful idea, but then when we went to do it, we found that they just wanted to play the games on the iPads, and we didn't have enough iPads, and so then some kids had to wait for them to get passed around, and it just kind of made it more complicated. So there may be instances where it's helpful, and there may be instances where it's not.
Yeah, I was just thinking, I know that we're involved in a research study in schools, and they have all the students have iPads, so they all have the app with the surveys on there already, and they just go and click the app and then fill out the survey. So it's pretty, so it's an opposite example of when it works well.
Right, yeah, see, it can go either way. And then there are some features, and I don't know if SurveyMonkey offers this, but I know Qualtrics does, where you can actually have people answer a survey using just text alone, so they don't necessarily even have to have an iPad or a smartphone. And so it's as simple as you can make it for people, the better.
Yes. I was also thinking that, and this is, you know, a potential connection between us as practitioners and our research partners, that when universities have access to technology that we may not, they may be a good partner. And I know that we did that with the University of Iowa with Lisa's group for our member inventory survey, because they had a more advanced survey collection tool than we did with SurveyMonkey.
Yeah. Yeah, sometimes you have to be flexible, for sure. We do that with Zoom all the time. I mean,
yeah,
unrelated to data collection. Okay, and then lastly, I would just say, and I'm probably preaching to the choir here, but use validated and instruments or items whenever possible. So if you don't have to recreate the wheel, it's really nice to go out and find a tool that you know is valid and reliable, that is going to get at those themes that you've identified as being important for your evaluation. So, any questions so far? We good? I'm going to assume no news is good news. Okay. And so this is related somewhat to data collection, but kind of say participants dropping out or participant attrition. When you've identified kind of a group of folks and you want to maybe survey or follow them for more than one data collection, that you have the issue of, you know, people just kind of drop off, and it's hard enough to get to incentivize people to take surveys one time, let alone following them for a period of time. And so I think, you know, one of the standard ways of doing that is actually adding incentives for participation into your budget. So there's a balance to that depending on who you're surveying, and, you know, how burdensome or how, you know, how lengthy the survey is, and then how much money you're going to offer, because you don't want that money to be overly persuasive and you know, and kind of influencing people who maybe don't really want to take the survey, but because of the situation they're in, and maybe there's like a lack of, you know, resources in this particular community, it can feel like, what's the word I'm looking for? It can feel like undue influence, I guess. So just keep in mind that balance. Keep your questionnaire short and try as much as possible to reduce the burden on the participants. And then I would say just consistent communication. So not only in terms of, you know, following up with folks and letting them know, you know, that you want them to participate in a particular, you know, survey or data collection, but then also thinking about dissemination of the results. So I think that for me, it's almost an equity issue of when you go and you take information from people and then you don't report back that information to them. So it's just taking without giving back. And so if you're going to take information, make sure that you're analyzing it and you're providing something useful, some sort of, you know, product from those data, and then you're reporting that back to the community. And I think, you know, if you have those good partner relationships built, they can be a really valuable resource in terms of helping to interpret those data as well, because they're going to have a different lens that they bring to the table than you do. And then again, incorporating the indicators that are valued by your partners. I think if they see themselves reflected in that evaluation, they're going to be more likely to participate. And so lastly, we have fear of negative judgment. So I think that this is kind of like the equivalent of like plugging your ears and like la 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 la. It's like, I think if you don't know what's happening, it can hurt you. So So really, just because you're not asking those questions and studying them doesn't mean that those problems don't exist. So it's better to know. It's better to ask the questions and to do the work, and then be able to use those data to make changes if there's something that really isn't working. And so I have, CQI there, so the continuous quality improvement, and that's part of that dissemination piece of, you're reporting that out not just to the people who you're kind of delivering services to, but the people who are providing those services, who are implementing the work, so that they know what are areas for improvement. And then if you've used a collaborative, and I'll say one other thing. So if it's an issue of like there's just one component of your program that isn't working, then that's great. You can try to address that. You can try to bolster that. But if it's an issue of just like this program is just not working in this setting for whatever reason, or the strategy, it's better to know sooner rather than later, and better to know that like maybe resources would be better used on another strategy. And so finally, I'll just say, if you've used a collaborative approach and people are engaged and they own that process as well, then there's a good chance that you'll have a more comprehensive perspective of what your impact is, and you'll have captured what, a broader aspect of what success could look like. And so I think all around it's better. So that said, we've left some time for discussion. And did we have anybody that had ideas of barriers that weren't captured?
No one filled out the other, but we could, ask again. I mean, I know one for me that I always encounter is, and one of my biggest challenges is around the feasibility piece, and and I think that that's a little bit around like evaluations can scary or complex, but I think that oftentimes when we're working on grant applications, we tend to like put in like everything that's possible, or on the planning phase, put everything that's possible, and sometimes when we get to the implementation, there's a barrier because the feasibility wasn't necessarily considered.
Yeah, the kitchen sink evaluation plan. I would really love to know. I would love to hear from those who also do evaluation and their expertise in terms of how they address some of these barriers. So, and any and all, but I mean, especially the time and resources, because I know that that's a big one that we come up against.
Well, I don't necessarily have any solutions, but one of the things, I think this goes back to your buy-in, your stakeholder buy-in. I feel like we often get approached because we have some expertise in that area, but as a really afterthought. It's like we're trying to get people to think as they're planning their interventions, their programs, but oftentimes we get included like, oh, we've already developed the intervention, we're already in the schools, and now we want you to come do an evaluation. You know what I mean? And so it's really hard. I think we're trying to shift the culture and the mindset about when to involve us, but sometimes we don't want to say no, but at the same time, we want to do something that's going to be meaningful and really, either show the impact. And sometimes it ends up just having to be process types of evaluation that we can do for them because of when we're requested to be involved. But I don't know, does anybody have any strategies or anything like that we could talk through about how do we shift the culture to get people really thinking about putting evaluation in from the very beginning?
I have experienced that same thing many a time. So I'll add to that and say, yes, it's frustrating. And sometimes it's part of like the nature of the beast when you get grant funding that like, oh, well, by the way, this grant started 2 months ago, so you better hit the ground running with this. But I know one way we tried to do it is in previous work is if you just setting up a relationship with the folks who are doing the grant writing, that they're doing it in collaboration with whoever would be doing the evaluation. And it's a no-brainer, but that communication doesn't always happen.
Yeah, I think that sometimes when we've experienced that too, as on the program side or the maybe practitioner side, is that sometimes we're limited in what we can make changes to on the intervention because the funding is prescriptive, and I think it's hard to balance that with like a way to improve the intervention or the prevention strategy so that it can be, improve the methods around delivering that program or policy so that so that the evaluation can be stronger. So kind of from the other perspective there.
Yeah, that's a really good Yeah, that's a really good point, because I think oftentimes it's some of what you're doing is very prescriptive, as you said, and it's really hard then to try to figure out how to infuse evaluation.
Yeah, but I do like that idea around how we shift the culture or the mindset so that we're involving our evaluation partners sooner, or as part of like even the funding opportunity development or application.
Who else has encountered that, and what have they done?
Oh, Jeannie, we see you speaking maybe, but don't hear you.
Oh, okay. How about now?
Can you hear me?
Yeah, now we can.
Oh.
Okay. It's the little,
Today's not
like,
my day for this thing for some reason. In what I've been trying to do is actually look at my evaluation components before I even look at what I'm trying to plan out, because that actually has helped kind of put that first, and that actually helps to guide what programming and what effective programming you're going to do. So for instance, like with our teen drivers, it's like, what do we really want them to know, and how are we going to find out if they're really learning that? And so by thinking about that first, then our programming can then follow those steps in order to help us easier to be able to evaluate easier, because we can just put in some simple questions and survey. And so I've been trying to put in and think about evaluation first before I do the programming. I don't know if people have done that kind of thing or if they've been successful. And the other thing is too is uh, I'm part of the Children's Safety Network COIN, and from that experience, I've really kind of learned that a lot of our evaluation doesn't have to be so grandiose. It can be 57 surveys from parents on, what they think about graduated licensing, because after a while it becomes the same response anyway. And so I think at least a little bit of surveying or a little evaluation of some sort is better than not doing anything. So those are kind of the few things I've learned over the last couple of years when it's come to kind of looking at our programming and evaluating then if we're being successful or not.
Yeah, I think that's a great point. I really like the comment that you made around, considering, the outcomes that we're interested in planning an intervention around, but also like how cyclical that is, the evaluation planning as well. So again, acknowledging it upfront. Yeah. Great.
And you were right about with the stakeholders, with the schools, and we're fortunate enough to have evaluators intake our surveys, and then each school gets their own individual trend report, and so schools that have been participating the last 4 years can see now how they've improved on several areas. And so I think that helps get funding for the program, and helps the school justify why they're doing the program, and then it helps me to continue to seek funding from all different types of partners. So that stakeholder part is important, as you were talking about on
sharing
the
data that's a great activity.
Mm-hmm.
It's a great way of building that up.
Yeah, I feel like sometimes, I don't know if others feel like this, but sometimes we put all this effort and work into collecting the data, and maybe using it real time, for programming purposes, don't always really share it back to all of the stakeholder groups, which, like you said, is important to do, and one of those things like, since it's down the road, we kind of forget to circle back with those stakeholders sometimes.
I think for me, I think of like the stakeholder engagement piece is like on the spectrum, and so there's the spectrum of like not including them at all, and then there's this gold standard of like being super inclusive and actually having things kind of more driven by stakeholders. and like that gold standard is really hard. I mean, like it's really difficult to meet that all the time. But I think if you're striving for that and you're working towards it, you're going to include some practices that are more inclusive, and it's just a good thing to aim for. What about the data collection? Because that was another piece that people had identified as being a barrier. So what do people, what solutions have people found in terms of, you know, trying to get over that barrier of data collection?
And I also saw, Sarah, you just unmuted yourself, so I wasn't sure if you were.
Yeah, but I was going to go another direction, so.
Well, that's okay. That's fine.
I was going to say, and you may have touched on this, Felice, but I was going to bring up another barrier that I feel like we've run into a few times with evaluations, just around like the sort of evaluating a moving target problem that sometimes can be an issue where like the program morphs and changes, which is like good and healthy in that kind of CQI, but sometimes that can make it really hard to know, okay, what are we trying to evaluate when, and we've seen this around collective impact types projects, especially. So I think that's a big challenge, and I'm curious if others, we've worked on some things here to try to really, push on like, what are the questions we're trying to answer? But I think there is often a tension between a really linear kind of project where, from the beginning we're trying to do X and we want to measure that versus programs that really shift and evolve over time. So I wonder if others have run into that or have ideas or thoughts on that.
I know that Celeste said, yes, Sarah. Fantastic.
Agreement. So one area that I am not super familiar with but want to become more familiar with is developmental evaluation.
Mm-hmm.
And so I know like one aspect of that is like kind of being able to be a little bit more nimble or flexible in terms of what are those evaluation questions that you're asking, and understanding that those could change over time. I haven't actually had the opportunity to really do one per se. So, but that's the thing that comes to mind is like maybe a structure more like that would be helpful.
Has anybody on the call had experience with developing developmental evaluations or implementing them, and how that's worked out?
That is the tack, that was sort of what I was referencing, because that's the tack we've taken with the Essentials for Childhood evaluation. And I think you're right, it is sort of built around those concepts. So it's a lot of like participant observer, like go to all the activities of the project and like provide continuous feedback. So it kind of has that element of continuous quality improvement. But it's just very different than what I think of as a more traditional evaluation. And I think it does still present some real challenges. I think it's a fairly new approach to evaluation. So I'd love to learn more about it. Maybe we should get a developmental evaluation expert to come on.
Absolutely. Yeah.
Has anyone else used it or interacted with developmental evaluations?
Anybody?
No, I think it is pretty new. I've had conversations about it, and I'm really intrigued by it. So,
for the one we're working on for Essentials for Childhood, the outcome that we're kind of working towards is a case study, which is nice because it gives you the opportunity to wrap in a lot of qualitative feedback from people. Mm-hmm. But there's not a lot of data. It's a lot of
It's a lot of process, like you said too, and it's hard to grasp around like that question that we're trying to answer, like you said, and I think also with those situations, I think maybe the important part is like that continuous stakeholder feedback as well, to make sure that people are on the same page, or as the program changes or the developmental evaluation changes, that maybe there's a new question we're trying to answer along the way, right? And maybe that's okay.
Yeah. I think it is okay. But if there are any kind of more distal things that you're working towards, at least having that be your kind of anchor in some way of like, well, we know that it's going to take a long time to move the needle on this, but this is kind of that bigger impact that we're looking to make, and hopefully that's a little more quantifiable. But again, you might not see so much movement on it.
What are any other thoughts or questions, or any examples when you've overcome evaluation barriers that you'd like to share?
One thing I'll mention that I kind of skipped over previously that I meant to talk about was when we were talking about the partner engagement, stakeholder engagement, is the outcome mapping piece. And so we talked just about defining common things that all of the stakeholders are interested in and working towards that. But I think outcome mapping is a nice way of kind of working backwards from that kind of ultimate end goal, that end impact, and then kind of taking steps back. I mean, essentially almost filling out a logic model of sorts of okay, so what do we need in order to make this happen, and then what happens before this, and then kind of what efforts need to go into that. And I think doing that process in a more kind of layman-friendly format with your different partners is a really great way of engaging them on the evaluation. And it doesn't have to be in a way where you're actually you have a logic model in front of you. It can just be a little bit more informal, and it can be conversations and probing questions. But I found that people get excited about that. They get excited about thinking about that end outcome that they're really engaged on, because that's why they're doing the work, or that's why they're there at the table. But then thinking about what's the roadmap for getting there is kind of fun.
Yeah, I was just, as you were talking, I was thinking that could be a good maybe tool or process to engage, because I think that could be a good tool or process for also the intervention plan or the program planning piece. And so that could be a good opportunity to marry both the evaluation, planning, and
yeah,
at the same time.
Yeah, definitely.
Makes sense. Are there any final thoughts? Sally, I know that you are an evaluation specialist at the CDC, so any thoughts that you have to share as well would be appreciated. But if not, we can end early. It's totally okay, I thought too.
No, I actually don't have any. This is Sally. I don't have any anything to add. I think it's interesting hearing some of the challenges that everyone's bringing up. That at the federal level, we have the same challenges. So I think this has been a really interesting conversation.
Thanks, and thanks for joining. Yeah. So I'm trying to think, do we have any other, there might be just a thank you slide at the end.
Yeah.
I did just want to, so our next learning opportunity is in May, and it's actually during the CDC's prescription drug overdose prevention grantee meeting. So for any states that are funded either by PSS, Prevention for States, or the Data-Driven Prevention Initiative grant, we'll be at that meeting. So it may make sense for us to cancel May's meeting, just because I think a lot of us from our region will be there, and then reconvene in June. So I'll definitely send out some communication about that. But I was thinking, oh, we can still have it. I'll just step away from that meeting because I'll be there myself. But then was realizing that a lot of us in this network may also be at the region, or at the meeting. And I'll definitely do some outreach out to see who's attending, because it might be nice to connect in person, even if it's just briefly if we have the opportunity. And then I'm working with someone at the National Conference of State Legislatures to come and join our calls. We've been playing a little email back and forth, just getting our scheduling right, but I'm hoping that she'll be available in June, and so look forward to that. But in the meantime, I will definitely post everything, and we'll share the links up to the website to remind people where to find the recorded sessions.
And then I just am briefly showing right here, here's just a few, and there's plenty more out there, but a few resources of things that I've found to be helpful, and primarily in that kind of engagement piece, but also in the planning piece. And I've taken a look at the CDC's evaluation resources, and they're pretty neat, and it's kind of cool how it leads you through in a very kind of, step-by-step way, the process of planning and evaluation. So take a look at those if you ever get an opportunity.
big thank you to Felice for facilitating today. I thought it was a great presentation.
Thank you all.
Bye, everyone.